Healthcare premiums could be going up for some federal employees. The Senate's new postal reform bill would change the mix of the federal employee health benefits plan and might leave people out of it. Jessica Klement is staff vice president of policy and programs for the National Active and Retired Federal Employee Association. Jesse, welcome. It's good to see you. Here's how I read this. It sounds like some healthy employees might be moved out of the FEHBP into a special plan, might leave older and sicker people in the FEHBP. That, of course, would drive up rates. Am I reading this right?
Yes, you took an exceptionally complicated policy issue and managed to drill it down into 10 seconds. So well done there, Francis. Thanks so much for having me. So what this bill does, and its House counterpart, they're identical bills, would separate the FEHBP risk pool into postal and federal. So right now we have about 8 million individuals in FEHB. This bill would pull out all the postals, and postal employees and retirees would have their own plan, except for a few postal retirees who would stay in FEHB.
There are people that are in some of the postal programs in the FEHBP, the NALC one and others, that aren't postal employees. Would that provision go away? Would those employees, those federal employees that use postal service plans and don't work for the Postal Service have to go into other plans? Would they be forbidden from using those plans moving forward? Or do we not know yet, Jesse?
They would be forbidden from going into postal plans, but theoretically, and there is a lot of analysis that still needs to be done on this bill by the part of the Office of Personnel Management, and that's what we're asking for. Do not take any further action on this bill until we have an analysis from OPM on how this would affect both classes of people. So in theory, Francis, you look at those postal plans, NALC, APWU, the rurals, they would have both a postal plan and an FEHB plan. So federal employees and retirees could stay in the NALC federal employee plan, theoretically.
What do we know about the provisions of this bill, the reasons other than federal employee health insurance that the Congress is potentially looking at making these changes?
So the thing that concerns us the most, NARFE, as an organization that represents all federal employees, postal employees, retirees, is the provision that allows postal retirees without Medicare to stay in FEHB. So the Postal Service wants its own risk pool. And the reason it does is because under this legislation, postal retirees would have to enroll in Medicare. So if you're a postal employee right now, when you turn 65, you will have to enroll in Medicare. When you have Medicare and other insurance, Medicare pays first. Medicare is the first dollar payer. That brings rates down in the federal plan and this new postal plan for everyone. It makes this group cheaper to insure. But under this legislation, if you are a current postal retiree who does not take Medicare when it is offered to you, there's a special enrollment period that waives late enrollment penalties. We're very pleased with these provisions. But if you don't take it, if you're like, no, I'm a postal retiree, I'm happy with my health insurance coverage, I made the right decision at 65, I don't need Medicare, you stay in the federal pool. And it's those group of people, retirees without Medicare, who are the most expensive to insure. And that is why, based on analysis from a 2012 bill that did something very similar, we think FEHB costs will rise for that segment of the population.
So I understand then the benefit to the Postal Service. The benefit to the Postal Service is that their risk pool goes down in price to insure because these folks, as I mentioned at the beginning, that are older and sicker aren't in the pool anymore. That's exactly the benefit to the Postal Service, right?
That is the benefit to the Postal Service, and that is why the Postal Service is asking for this to bring down its healthcare costs with this Medicare integration. What we don't know is, of the tens of thousands of postal retirees currently without Medicare, how many of them will take advantage of this special enrollment period with the waiving of the late enrollment penalties and take Medicare. My anecdotal evidence says probably a good number of them. We hear from NARFE members all the time who made a decision at 65 when they were healthy not to take Medicare that does not suit them anymore later in life. And they say to us, I really wish I would have taken Medicare. So I think a good number of people will take advantage of this option. We don't know how many, and we don't know the effect those who don't will have on FEHB. We can venture a guess based on analysis from a 2012 bill that's very similar, But what we're doing is encouraging Congress, both House and Senate, not to move with this bill any further until we have that analysis.
There's a letter from your president, Ken Thomas, that we'll link to at govmatters.tv/resources that explains all of these positions. What you said there's lots of don't knows, and you're asking for basically a pause, it sounds like, Jesse. What do you want to happen specifically? You've kind of touched around the edges of what you want to happen more broadly, but what do you want to happen specifically in this analysis? What's a good result in your view, whether Congress moves this bill forward or not?
So what we're asking OPM to do is hopefully they're checking in with their carriers, right? Let's just use Blue Cross Blue Shield as an example because they are the largest carrier in the FEHB program. Blue Cross Blue Shield hopefully can say to OPM, we have this many postal retirees. There are this many who don't currently have Medicare. We can reasonably assume X percentage will take Medicare if offered to them. What we need to know is how many of those most expensive to insure, the postal retirees without Medicare, would stay in FEHB. And when they do, OPM should be able to tell us, okay, we have a smaller risk pool now. We have 6 million people instead of 8 because there's 2 million in the postal pool. And if this many people now with a smaller risk pool are more costly to insure because they didn't take Medicare, that's going to have effect on premiums for everyone, probably going to go up. We need OPM to tell us if that is in fact true, what their analysis shows, the effect on the entire FEHB population.
Jessica Klement, thanks very much for joining me. It's great to have you back.
Thanks, Francis.